Doctors at a top Twin Cities hospital say that they're ready to help patients exposed to an invisible threat. Hennepin Healthcare has already treated more than a dozen patients for carbon monoxide poisoning in just the past month. New at 6, WCCO's Esme Murphy shows us how the hospital's hyperbaric chambers give the sick a second chance.
So this goes over the top and around the side.
Our model patient is St. Paul firefighter EMT Ryan Mueller.
Time is of the essence.
An hour and a half of breathing this pressurized oxygen can help rid the patient's blood of potentially deadly carbon monoxide.
You may notice a headache, you may notice a feeling of lightheadedness or nausea, or you may not notice anything until it's too late. That's what makes it so insidious and so dangerous.
In November, a dozen people were treated here for carbon monoxide poisoning. Cases always rise in colder months with the use of furnaces and people working on gas motors in closed garages. These hyperbaric chambers can also be used to treat severe burns and also wounds that don't heal. Those are more common reasons to come here. We spoke to Thomas Roinstad after his hyperbaric treatment to help wounds heal ahead of surgery.
You feel a little bit more refreshed. You know, first your nerves gotta settle down.
A former mechanic, he's also been treated here for carbon monoxide poisoning.
Fixing cars, one of the exhaust hoses fell off in the garage I was working at.
The staff here says the best prevention is to have carbon monoxide monitors in your home, and they actually give one to all the patients that leave here. With photojournalist Tom Avilas, Esme Murphy, WCCO News.
Doctors also asked us to share this warning. Beware wellness centers that advertise hyperbaric sessions as a rejuvenating treatment.
They say the misuse of equipment can lead to a potentially deadly fire.